COVID-19's newest strain is JN1, which is from the lineage of Omicron 2.86, which was a subvariant of it. So basically, Omicron family is producing different variants and subvariants, and JN1 is one of those. It was identified just a couple of months earlier, and within very short time, it has replaced other variants of COVID-19. So in US, in around 4 weeks' time, now it is 50% of all their COVID-19 cases are due to JN1. It has been found in more than 50 countries now, including India, China, US, other European countries. And it's only a matter of time when we will find it pretty much in each country, the way it is spreading across the globe. It's very difficult to tell so early that is it going to be more severe than other strains or other variants we saw earlier. So severity only comes up after some time, because if you know, it takes some weeks of illness before somebody gets sick and need hospitalization. So, and that's too early for Omicron that we can decide is it more severe or not. It is more infectious, that we know. The symptoms are pretty much the same like the other variant, but the most recent data which I have seen, the most common symptoms, signs and symptoms of JN1 are, running nose, like flu-like symptoms, but also many people are complaining about sore throat, and such a painful that they feel pain while swallowing anything. So that is something added into it. Diarrhea or loose motion is also one of its recent JN1 symptoms. The symptom which was very common in earlier COVID-19 cases, which was loss of sense and taste, the new JN1, it is only present in like 2 or 3% of cases. So basically they are the same symptoms, but with some variation. Nearly all viral infections have very common symptoms and vague symptoms, and it's very difficult for a common man or even a doctor to differentiate just on the basis of signs and symptoms, unless there are some telltale signs and symptoms, which we had in COVID-19, if you remember, was that loss of sense and taste. So that was such a paramount or important symptom that ensured the diagnosis by anyone that a person is suffering from COVID-19. But otherwise, they are the same symptoms: the weakness, the body weakness, as I said, flu-like symptoms. So it's not. It's very difficult. The important thing is that if you are not feeling well and you have flu-like symptoms, you should stay home and you should take precautions. It doesn't matter what type of respiratory infection you got, but most respiratory infections are easily spread, especially in winter. So winter is a bad month for respiratory diseases. That's why we see hospitalization in the winter months due to pneumonia and other lung diseases or respiratory diseases. So the best thing is that if you are not feeling well, stay home, take precautions, stay away from other people, wear mask if you are going to meet other people, and keep the distance. Ventilation is important. Does not matter it's COVID-19 or other respiratory infection. If your room has reasonable ventilation or air circulation, you will still be protected from most of the respiratory diseases, unless a person actually coughs on your face. Otherwise, that's a most, I would say, potent intervention we have. Again, it is at this time difficult to tell that the situation will be more alarming or not. But the one thing is for sure that hospitalization rates across the globe have gone up in this winter, and it's not only because of the COVID-19, but for the respiratory diseases also. But COVID-19's levels in sewerage water, because many countries are detecting presence or absence of COVID virus in their sewerage waters. What we are seeing is the highest level of COVID-19 in sewerage water in most of those countries, and that it was started in 2022, especially in some European countries, and they haven't seen that level. So it shows there is a huge activity of COVID-19, but at this time we are not sure if the increase in hospitalization is due to COVID-19 alone or some other respiratory diseases. Yes, so just as I said earlier, prevention is that if you are required to have vaccination, get your COVID-19 vaccination. If you are old, especially, ensure that at least yearly you get a booster dose. That's being recommended across the globe, because whatever immunity you get by a vaccination, normally it is waning off within 6 months to 1 year. So if you come into the high-risk group, then make sure that you get your booster doses on time, on schedule. For other people, I would always recommend that if you are sick, stay home, open your windows or doors to have a good air circulation in your room. Especially, I'm not saying that if you are meeting with your own family members that you open your windows in winter, but if you are meeting with any visitors, meet them in a room which has an open window or door, or best of all in outdoors, in sun. If you are getting the sun these days, outdoors are much better, much safer for meeting people or entertaining visitors, especially when we have such a high rise of COVID-19 and other respiratory diseases. Biggest lesson of infectious diseases is, or the first lesson of infectious diseases, that infectious diseases don't respect your national borders. So it doesn't matter you are screening at the borders or not. If a virus is spreading in your neighborhood, it will eventually come to your home. That's so simple in that. So in my mind, I have very clarity that if virus is spreading so much in India, probably we already have one. So JN1 may be already in Pakistan. We may not have detected it yet, but that doesn't mean it's not present here. So that's one thing. You can't stop JN1 spread, and the way it is spreading at such a fast pace across the globe, there is no way we can stop it at our borders. So that's one thing. Second thing is what to do as a country, as a country perspective. We need to increase our detection. We need to improve our detection, our testing, and do it in a proper way, what we call disease surveillance system. So we should know that in these days we are having whatever number of hospitalization due to respiratory diseases, how many of them are due to COVID and how many due to other diseases. Unfortunately, we don't have that idea.